So let me talk a little bit about heat and wildfire safety. There is a nexus, obviously, with COVID, but it is an important public health measure that we keep an eye on. I actually used to have a more fulsome job with related to public health and not just COVID. So, but first, let me make the connection for you, if you haven't already, that they both poor air quality, smoke, and air pollution are obviously contributors to a respiratory system that can be put at risk. So what we want to do certainly is avoid having the co-occurrence of having smoke inhalation and COVID disease. So for both reasons, this is a really good time to be spending more time in your home. Certainly in air-conditioned settings, that is the most important thing that we can do in this type of environment at this time. We do want to mention that there is a cooling center available in North County in the city of Paso Robles. That is at 600 Nickerson Drive. And that is one cooling center, but our county libraries are available, any manner of stores where you can get inside for air conditioning. If you don't have it in your home, take advantage of the opportunity, at least at some point during the day, to get yourself cooled down through air conditioning. If that's not a possibility, then fans, and especially fans with cold water, spray in front of the fan. Use cool cloths while you stand in front of the fan, and really make it a concerted effort to bring your temperature down if you're spending day after day in these heat conditions. Also, use a buddy system. Very much so, we worry about the elderly. Many people who live by themselves and may not even be aware of the health impacts that they're experiencing. So make sure that you have someone that's checking in on you. If you have both the person themselves, but we also ask of you if you know of a neighbor, a family member, a friend who lives by themselves and doesn't have air conditioning or is potentially at risk from this type of heat, please check in on them as well. Don't wait until thirst hits. Drink water. For anyone who's an outdoors person knows that mantra, that once thirst hits, you are way behind. So drink plenty of water, force feed yourself water in these times, rather than waiting for thirst to be your signal that it's time to drink. Light-colored clothing, loose-fitting clothing, hats if you're outside to protect against any sun, even though it doesn't look like the sun is out. All of those are additional protective measures. And lastly, react immediately if you notice someone else is getting into trouble with this heat. So there's two levels of concern. Heat exhaustion will show up as heavy sweating, weakness, cool, clammy skin, and a fast and weak pulse. But even more importantly is heat stroke, which is an absolute medical emergency, and the person needs to be cooled down immediately. Put them in a cool bath, cool towels, shower, any way to get that person's temperature down. Heat stroke presents with a high sudden fever of over 103. The skin becomes hot and red. Sweating ceases, and a rapid and strong pulse is what you will see in that case. Also, confusion might set in. So be aware of these kinds of symptoms and take immediate action. If you see smoke and ash in the air, as we are doing today, it is important to get indoors. Again, if you are going to go outdoors to run errands or try to do some type of, walk, get some kind of, outdoor experience, or just even need to go someplace, do so on either end of the day, not in the heat of the day. And this is especially true for children, the elderly, and those with underlying medical conditions. So for most up-to-date information on the air quality conditions, we have our Air Pollution Control District's website at slowcleanair.org, or follow them on social media. You can also sign up for text alerts related to dust, wildfires, and the air quality that we're seeing.